Welcome to StartUpHealth TV, where we celebrate the entrepreneurs and innovators who are transforming the future of health. I'm Logan, and I'm here with Brian McCourt from Able Channel. Brian, thanks for joining me today.
Thanks for having me, Logan.
It's been great to see your journey over time. We've gotten the chance to talk at various conferences over the years, and I was always really taken with this idea of a streaming service for healthcare. And many times I have talked to people about the need for this idea of content you actually want to watch that can help you be healthier. Where did this idea come from?
Well, it's kind of a personal journey. My son was diagnosed with autism spectrum disorder, which kind of prompted me to say there needs to be more information about healthcare. So that was the impetus behind it.
Okay.
And now it's just grown. In fact, we recently, not only are we launching the channel, but we're also amplifying issues related to disability, mental health, really all different conditions. But most recently we had a really successful series called Together We Are Able, which focuses on diversity, equity, and inclusion for folks living with disabilities. And not only did it air on our channel, but we distributed it, and it was picked up by ABC, NBC, CBS, and now we're up for an Emmy Award.
Congratulations,
So,
that's awesome.
really exciting.
What were some of the storylines? Well, maybe my question is, did you have a favorite storyline within that show?
Yeah, it was interesting because it was really 10 stories of people who live with disabilities and the value and the importance of work for the community. 82% of people with disabilities are not born with them. They acquire them after birth. So that's inevitable. 1 in 3 Americans will have a disability, will be disabled before retirement.
Wow.
So it's pretty substantial. And since the ADA was passed nearly 30 years ago, there's only been a 1% increase of the hiring of people with disabilities.
Wow.
So I thought this was a really important program for us to produce. And as it turns out, this is the first program that I've ever seen that features 100% people with disabilities in the program. So it's hosted by two-time gold medal winning Paralympian Mallory Wegman. She hosts the program, and as I said, it's really the only show that I've ever seen on television that features 100% people living with disabilities and telling their stories. What's it like to be blind? What's it like to have autism? What's it like to have dyslexia? So now you're hearing it from people who are experiencing it versus, just hearsay.
Let's talk about the quality of the content, because you have a Hollywood background, and we've all seen healthcare content, whether it's owned by a hospital or whether it's shared on PBS, that doesn't draw us in the way that a great Netflix show does. So talk to me about the importance of creating content that's really going to be at the bar that people are expecting.
Yeah, you're not wrong. Healthcare content historically has been pretty low bar and also not engaging. So what we try to do is really, use the skills and techniques that great filmmakers and television development teams focus on to tell real stories of the human spirit, which is, indomitable at the end of the day. These real stories touch you in a way that, scripted content really doesn't. And the other part of this is that if you think about it historically, I don't think we've talked about this before, is that I think it's 50% of the top 50 shows of the last 50 years are all healthcare related dramas.
Interesting.
Yeah.
Like ER, like Grey's Anatomy, shows like that.
Yeah.
I was obsessed with ER growing up.
Yeah, exactly. I mean, you just go down the list of television programs that deal with hospitals. But at the end of the day, we live in a world now where, people have a voice and they need to be heard. But how do you get up above the din? And when you think about healthcare being 20% of GDP and the fact that there is no healthcare channel, right? We have every kind of media program, every kind of sports show under the sun, but people need healthcare information but they need it presented and packaged in a way that makes it accessible, that makes it comfortable, and at the same time, widely available. And that's really where Able Channel accelerates and amplifies those stories.
What kind of stories do you want to tell next?
Well, it's really the marketplace that's drawing, creating that need. But we're now launching on, actually making an announcement here at Vive that we are launching on Roku, as well as Amazon Fire. So our direct-to-consumer side of things is taking off, and our direct-to-patient side of things as well. So when you ask about the kind of content that we're producing, it's everything from diabetes to oncology to orthopedics. It's folks that are in the biggest patient populations out there that need help and information. Because when someone's sick or struggling with a chronic condition, it's a family affair, and you really want to know from quality, credible resources, the information that you're getting is real.
Talk to me about what you really envision around, clinically validated but high quality content, because I know you're not just talking about a scripted show where someone happens to have cancer. You're really talking about bringing in the clinical element. And I remember watching episodes of Surviving Suicide, which is a beautiful series, and you would bring in a physician voice into the show. And so it was an interesting mix. So going forward, how do you see these types of shows being formulated that combines those great narrative elements, the documentary style that we're used to on TLC or wherever, but with more of a clinical edge?
You bring up a really good point. The fact is we're showcasing the clinicians themselves. So in the program that you mentioned, Surviving Suicide, we work with the behavioral health group from Cleveland Clinic, which is a partner of ours. We want to be able to showcase the doctors on the front line, the doctors and the nurses, and the folks that are providing the care, because they're the ones that we rely upon not only to for our care, but to tell the stories. They're the ones that are living this day in and day out. And in fact, one of the things that was brought up yesterday was a doctor from Stanford calling to mind the issue that the healthcare writ large is struggling with, which is helping the doctors themselves. High rates of doctor burnout, substance abuse disorder,
Physician suicide.
Suicide, yes, exactly. And so we want to put the microphone literally in the hands of people who are dealing with these issues, because we're all at risk. If the industry goes down, who's going to care for us?
Yeah. That's been one of the themes throughout these interviews, is how many companies, their missions flow back to physician burnout, and that if you help smooth out some of these wrinkles, these challenges, that you empower physicians to thrive and to take care of the patients the way that they always wanted to, right?
Yeah, absolutely. We want to be able to care for the caregivers and also the care providers. Unfortunately, we live in this attention economy. Everything is very rapid. It's snackable content. It comes and it goes. And it's really important that the voices of the clinicians and the organizations that we work with, that we're advancing their stories, getting the information out into the marketplace so that there's something to stem the tide of misinformation around healthcare. And that's really what we're seeing more and more of.
I'm curious to hear how you're walking that line as a media pro. Obviously, you also have to play in the world of short form content, just in terms of that's our world that we live in. So how are you sort of building the guide rails to make sure that you're still creating the quality of content that you want, even in our short attention span world?
Yeah, it's a challenge to say the least. So what we typically do is we shoot long form, and then we'll cut it into short form, medium form, ultra short form. But the other thing that we're doing is, to your point, we recognize 7-second clips can be produced, distributed, and impactful if you're doing enough of them, right? They have to be done right. So that you can have a story. If I'm saying one sentence at a time, the cumulative effect of that is, a full narrative.
Sure.
So that's what we're doing.
Let's go back to your announcement about Roku, which is really cool. So anyone who is using Roku gets the Able Channel app, and then sort of how do they access your content from there?
Sure. So they can do is exactly as you said. They can download the app on Roku. The same thing with Amazon Fire. Just download it and you get the Able Channel app. And then later we're going to make an announcement about Apple TV.
Okay.
It'll be available there as well.
Paid subscription?
Initially, no. We're offering it for free.
Okay.
So folks can get, just basically have to sign up. And then as time goes on, our hope is that, more and more folks will come on. It'll be either subscription or advertising sponsored.
Okay.
We don't want a paywall necessarily to impact the ability for folks to access the content. Social determinants of health, we want to impact healthcare. So the more people we can reach, whether they have the ability to pay for a subscription or not, should not be impeded. So we do have the option of having them watch ad-sponsored versions of the channel as well.
So someday in the future, I might have my doctor prescribe me the download of a streaming channel. Say, go watch some shows.
Yeah, I mean, that's happening now. Some of the hospital systems we're working with, where a hospital system will now have its own vertical channel, and then the channel will be part of your care path, where the prescription, depending on your condition, doctor could actually prescribe content for you.
And that would be a different channel. That would be like, let's say, the Cleveland Clinic channel versus the Able channel on Roku, correct?
Well, everything is Able channel. Don't want to make that mistake. They come on to Able channel, and you can find your provider,
your channel,
on the channel
within the streaming service, maybe.
Exactly.
Got it. Okay. And if they're on the Able channel, what are some of the shows that they'll find? You mentioned Together We're Able. We talked about Surviving Suicide. What are some other shows?
Yeah, so we've got a whole host of shows with our partners, like with Ochsner, for example. There's a whole maternity series. There's oncology series. There's all sorts of programming within the healthcare space. And we have, on our end of things, our original programming coming up. We've got a series with Cleveland Clinic coming up. We've got a series with Harvard that's coming up. And all of these programs are really dealing with first-person stories, and also with a clinical outlook to them. So really exciting. We're starting to see it all come to fruition, which, this has been a journey for us. But
yeah. I mean, it always is. It always is. But I know that you have been pushing on this. It's been exciting to be checking back in with you quarter after quarter, year after year, and see you, pushing through tough entrepreneurial times, and then coming out the other side. So I couldn't be more excited about what's coming next for the Able channel, and I wish you the best going forward.
Thank you, Logan. Really appreciate it.
All right. Thanks for the update.